This is Rebecca from the Oaks giving advice post-operatively for general anaesthesia and sedation. We advise that you keep your pet warm and quiet for the next couple of days. They may be a bit more sleepy than usual. It's important that dogs have minimal exercise on a lead for the next 2 days, and cats are kept indoors with a litter tray. We don't like animals to be able to go outside and do something that they wouldn't usually do as a result of the anaesthetic in their system. If your animal has been neutered, it's important that cats stay indoors for 3 weeks, that dogs that have been castrated are kept on a lead for 10 days before being allowed back off lead, and that bitches are given minimal exercise for 10 days and only on the lead, another week on the lead after that, and then gradual return to exercise off lead following that. For animals that have had dentals or non-surgical procedures, they can go back to normal exercise after 2 days. If your dog or cat has had sutures, it's important that you don't let them get to the wound. We are not responsible for making sure that your animal does not pull its stitches out. That's up to you, and there are charges if they do need resuturing. So please purchase a buster collar if you need one, and make sure that that's kept on at all times, and particularly at night, to prevent them getting to sutures. Usually cat spays, dog spays and dog castrates have intradermal sutures. That means they're within the skin and there's much less chance that they can do any damage even if they lick those, but do keep an eye on the wound. If there's any irritation where the hair has been clipped, please let us know. Sutures are generally removed at 10 to 14 days. The intradermal sutures are dissolvable, so don't need to be removed, but any of the sutures will need to be removed by us. Bleeding can occur from a wound site, especially in the first 24 hours after a procedure. If there is dripping from the wound, if there is more than a teaspoon of blood loss, if there's anything you're concerned about, please call us straight away so that we can give you advice. There may be some bloody fluid from the mouth if an animal has had a dental with tooth removal. That's fairly normal, but again, if there's copious amounts of blood loss, please do let us know. Animals can go home and have a small meal. If they've had a dental, we advise soft food for several days afterwards, particularly if they've had tooth removal. Usually a week is sufficient when they've had teeth removed. Otherwise, a small meal of their usual food so that they don't have any changes to their gut. And if there's any vomiting, please let us know. It's usually just a one-off if they do vomit as a result of the anaesthesia, but if it continues, we can stop that from happening with an injection. Usually we'll ask to see you a couple of days after a procedure if your animal has had sutures, but at the moment we're going to ask you to email us pictures of the surgical site and keep a close eye on it for any problems. We will get back to you within 24 hours to let you know that we've checked your photos. If you don't hear from us, please let us know. In the meantime, you can look out for any concerns with the wound, any redness, pain, discharge, anything you're concerned about, smell. If there's any problems at all, please give us a call. If your animal has bandages, it's really important that these are kept clean and dry, and they're usually changed at about 2 days. So we will need to see you back to do that. If a bandage gets wet, dirty, smelly, or is bleeding through the bandage, you must let us know as soon as possible. Any concerns, call us straight away. Photos and advice can be emailed, or questions can be emailed to info@oaksvetsbirmingham.co.uk, and the address is also on our website. Thanks.